and welcome to the Rational Living Show. I am your host, Dr. Aldo Pucci. This is a weekly show broadcast live every Wednesday at 7 p.m. Eastern United States time. I'm president of the National Association of Cognitive Behavioral Therapists. We're based here in the Pittsburgh, Pennsylvania area. I developed an approach to cognitive behavioral therapy that I call rational living therapy, and I've had the great fortune of being able to train thousands of therapists across the United States and abroad over the past 40 years and provide supervision, ongoing supervision for them, and very thankful for that. Rational living therapy focuses on the fact that our thoughts cause our feelings and behaviors, not people and situations and things and events. And I am the author of two books: The Client's Guide to Cognitive Behavioral Therapy, which is currently in its second edition. It was just released earlier this year. And also The Feel the Way You Want to Feel No Matter What. You can find both of those on Amazon.com. This is an interactive show. If you're listening on Podbean, you can use the Podbean app to call in with your questions or comments, and I'll be glad to answer any questions that you have. And if you're watching on YouTube or Facebook or X or LinkedIn, you may type in your questions and or comments, and I'll be glad to address those as well. The title of this week's episode is Panic Attacks, Fast Strategies That Work. Now, if there's one thing that encourages people to seek therapy, it is panic attacks, which used to be called anxiety attacks. A panic attack is different than anxiety, a lower level, steady level of anxiety. A panic attack is an intense episode of anxiety that's characterized by several different things. Typically, there is rapid heartbeat during a panic attack. So you can feel your heart beating faster. And sometimes because it's beating faster, it might actually you might actually feel skipped beats, well, sometimes, but at the very least, rapid heartbeat. Increased breathing rate and more shallow breathing very often you will see. Also an increase in blood pressure. Now, most often when someone's panicking, they're not measuring their blood pressure. They're too worried about panicking, but sometimes they'll do that. Shaking and jitteriness, very often that'll be the case that they'll do that. Lightheadedness, dizziness, a sense of feeling as though you're going to pass out. But in fact, rarely do people actually pass out when they panic. And the main reason for that is because when people pass out, their blood pressure drops. When you panic, your blood pressure increases. But because your blood pressure increases and you feel dizzy, it gives you the perception or impression that you're going to pass out. Also, a heaviness in the chest. And that heaviness in the chest often is mistaken for a heart attack. And then when a person experiences, whenever they panic and it feels like a heart attack, that then often activates their fear of dying belief or fear, and which then makes panic even worse. Now, let me caution you that if indeed it seems as though you're having a heart attack, go to the emergency room. Rather than just brushing it off as an anxiety attack, a panic attack. If it feels like you're having a heart attack, be sure to get checked out. Okay, but then once you get the information from the doctor that indeed your heart is fine, then we can approach it in a psychological way, right? So one of the things that we do, and I encourage you to do, is work at determining if you panic, is it learned or is it not learned? A learned surge of anxiety or panic attack is a reaction to something. Okay. Sometimes that reaction is so quick that a person doesn't know what they reacted to. So it will give them the impression that they didn't react to anything. I don't know. I just was minding my own business. And then all of a sudden, I started feeling very anxious. My heart started beating really fast and felt like I was going to pass out. And so very often what people will say is that the panic attacks come out of nowhere. They just happen. And so, one of the things that I have people do, and I encourage you to do, if in fact you panic, is to do a pattern analysis. So, what you can do is you can get a piece of paper and write down, make some columns on this piece of paper, the date and time for one column, the location. In other words, where were you when you panicked? What were you doing right before you panicked, or what was going on right before you panicked? And then what happened, another column, what happened while you were panicking and shortly thereafter. Okay. And so sometimes what happens is people will say, well, it just happens any old time. It doesn't seem to matter what's going on, or they don't see any pattern on the surface. But then what they do notice, though, after they do a pattern analysis, is that sometimes they do establish a pattern. That, don't you know? It seems like the only time really that I panic is when I'm in social situations, or when I'm sitting in a recliner after a long day's work, or when I'm driving. Um, and so that can help us to then, since we have a pattern of, don't you know, every time they panic or just about, they're in a social situation, then we can start to examine, and you can start to examine. Why would I panic about being in a social situation? So if I'm panicking, it means I'm afraid of something. So what is there to fear? What might I be afraid of in those situations? Sometimes, for example, I've seen this many times where a person mainly or mostly panics when they sit down in their recliner after a long day's work to watch television. And one of the reasons for that is because if a person's been making themselves anxious about something, sometimes they get relief by working and being busy, because that takes their mind off of what they've been making themselves anxious about. But then once they sit down and give themselves the opportunity to relax, now they have an opportunity to think. And especially if something on the television reminds them of things that they've been worried about, like maybe they've been worried about the possibility of them having cancer, and then the commercial comes on for a cancer drug, then that reminds them of what they've been upset about, and so they start panicking over that. Okay, and so often when a person examines, breaks down their panic in this method of the pattern analysis, they will discover that that indeed there is a pattern, that there are some things that they are reacting to. Okay, but if no pattern is recognized at all, it could be that the panic symptoms are the result of a physical problem, and such as hyperthyroidism, for example. So it's a good idea to certainly to get a medical evaluation to see if something like that might be causing the panic symptoms. Okay. Otherwise, panic is caused by fear, and what tends to maintain panic is a fear of panicking and the avoidance of it. And fact is, avoidance is fear's best friend. Okay, avoidance is fear's best friend, because as long as I avoid this thing that I'm afraid of, then I don't give myself a chance to see that I don't need to be afraid of it. That as long as I avoid stepping onto an elevator, I don't give myself a chance to see that it won't get stuck between floors, or even if it does, that I won't suffocate. Okay, so that's why anxiety just loves avoidance. Fear just loves avoidance because avoidance helps to maintain that fear. So as long as people phobically avoid panicking, that maintains the idea that panicking is something to be avoided. Okay. Looks like we have a question. Someone asked, "Do you have to have all of those symptoms for the rapid heartbeat, etc., for it to be considered an anxiety or panic attack?" And the fact is, you don't. Some try to operationally define what a panic attack is for diagnostic purposes, but in reality, we really don't need to do that. Panic is a more intense episode of anxiety, but it's more. But for practical purposes, if it's something to work on, you're realizing it's something to work on because you're feeling more anxious than you care to feel. Okay, that's the bottom line. Okay, all right. So panic is maintained by avoidance, and a fear of panicking then leads to that avoidance, and therefore so a person might begin by panicking over something, or even it could be something like your heart flutters or something like that. Maybe you have a PAC or a PVC, a very temporary abnormal heartbeat, a skipped beat, so to speak. And then a person might really make themselves anxious about that skipped beat, thinking that there's something wrong with them. And then because that high anxiety level was so uncomfortable for them, they start fearing that they will feel that way again. And then that fear causes them to actually panic again. Okay. So I'm going to share with you 9 simple things that you can do to to deal with panic, to help you to stop panicking, not only in the moment, but in the future as well. Okay. The first technique is called drop the safety battle. Drop the safety battle. And it's a very simple 5-second thing that you can do. And you can simply say, so if you start to panic, you can simply say to yourself, "This is panic. It's uncomfortable, not dangerous. Let it rise." Okay. So this is panic. It's uncomfortable. Let it rise. Now, why does that work? Because panic, as I mentioned, is reinforced by escape and control attempts. So the fastest way out is to stop fighting the sensations, just to allow yourself to feel those sensations, and and rather than fighting it. The fighting it actually makes it worse. Okay. So the first technique is called drop the safety battle. The second technique is called the 90-second rule. The 90-second rule. Okay. And what you do with this is you commit to riding the wave of feeling anxious for 90 seconds without any kind of escape or reassurance. Okay. So you commit, if I panic, I am going to allow myself 90 seconds of just panicking. Now, why does this work? Because the physiological surge of panic cannot biologically last very long unless it's fueled by attempts to fight it, fueled by fear behaviors. So eventually, what happens is your body runs out of the chemicals that it needs for you to maintain that panic, and then you just naturally, your anxiety level just naturally drops off. So, but keep this in mind: you're not waiting for panic to stop. You're waiting for your fear of panic to stop. Okay. So you just commit yourself, and this is the plan that you have ahead of time, that if I panic, I will ride this out for 90 seconds. So if you start to panic and assuming you're not driving or doing something like that, you can look at your watch or look at your phone and see, measure that time, the 90 seconds. Okay, so the 90-second rule is the second technique. The third is called the deliberate symptom exaggeration. Deliberate symptom exaggeration. And so, what you do with this is you try to intensify the symptoms for 20 to 30 seconds. Okay, so you try to make those symptoms that you feel if you're when you're panicking even worse by, for example, breathing a little faster, perhaps tensing your chest, saying to yourself, come on, panic, do your worst, give it your best shot, that sort of thing. So really working at making yourself feel even more anxious while you're panicking. And why does this work? Because it reverses the fear control loop. Panic collapses when it's invited instead of resisted. Okay, and that's what happens when you deliberately try to exaggerate the symptoms, when with this deliberate symptom exaggeration technique. Okay, I think we have a um, someone asked, control your thoughts. Yeah, and that's one of the things that we're going to talk about is that how can we stop panicking to begin with? And it begins with fearful thoughts, and we're going to actually talk about that. Yes. The next technique, the fourth technique, is called slow exhale breathing. Slow exhale breathing. And by the way, this is not deep breathing, but it's slow exhale breathing. So what you do is you inhale for 4 seconds. So 1001, 1002, 1003, 1004. Then you exhale for 6 to 8 seconds. 1001, 1002, 1003, 1004, 1005, 1006. And why does this work? Because longer exhales stimulate the parasympathetic nervous system. The parasympathetic nervous system is what calms you down. The sympathetic nervous system is what it kicks in whenever you make yourself anxious, and it's that sympathetic nervous system that makes your heart beat faster and all. And the parasympathetic nervous system slows your heart rate down and calms you down. Okay, so this longer exhale stimulates your parasympathetic nervous system without becoming a safety behavior. In other words, you're not trying to escape anything. So keep in mind with this, you're not holding your breath, you're not trying to breathe perfectly or anything like that. All you're doing is inhaling for about 4 seconds and then exhaling 6 to 8 seconds. That longer exhale will help your body to calm down. Okay, and if you have any questions, be sure to type them. If you're watching on YouTube, for example, if you're listening in on the Podbean app, you can call in with your questions. Be glad to answer them. The number five, the next technique is called name it, refuse to analyze it. Name it, refuse to analyze it. So if you start to panic, just simply say, "This is panic. This is adrenaline flowing through my body, activating my heart. This is panic." But what you don't do, what you avoid, is asking, why is this happening? What does this mean? What could this mean? Can I stand it or anything? No, all you're doing is just naming it without analyzing it. And by doing that, by simply just naming it and focusing on naming it, what you're doing is interrupting any kind of catastrophic interpretation of the of panicking. Because remember, that's usually what happens: is a person will panic and then they will make themselves miserable about the fact that they're panicking. And so by just simply naming it and leaving it at that, it helps you to avoid putting fuel to the fire of panic. Okay. All right. Let's see here. Someone asked the combination of 4 and 5 would be good, slowing down that slow exhale and naming it. Sure, it would. Yeah, so a combination of the two could be very helpful. An additive effect. The number six technique to deal with panic is called anchored attention. Anchored attention. And so, what you're doing with this is you pick one neutral external target and describe it in detail. Okay, so it could be, a painting on the wall, or a tree if you're outside or looking out your window or something, and then just describe it in detail, the colors that you see, the shapes, perhaps the sounds that it's making, if it's making any kind of sounds. And so you focus on something in your environment, whatever it might be, and work at describing it to yourself in great detail. And so, what you're doing with that, the reason why it works is because the attention is withdrawn from your internal sensations. And so, therefore, by putting your attention on this external thing, it helps you to avoid catastrophizing these feelings that you're feeling until you stop feeling them. Okay, so anchored attention is number six. Very helpful technique. Oh, it looks like we have a call. Is that we still have? Okay, okay, no, I see. All right, great. Number seven is called the stand still rule. Stand still rule. And so, with the standstill rule, if possible, do not leave the situation during panic. Okay. Um, do not leave the situation during panic if possible, because leaving the situation teaches your brain escaped saved me. Okay. So, if you tend to panic in certain situations, and you panic in that situation and you leave that situation, what it's telling your brain, what you're training yourself to do is to or to believe is that escape saves you, and that's the opposite of what you want to train yourself to believe. Okay. Um, so staying in that situation, what you're training yourself instead is to believe that nothing needs fixing. So, because what you're doing is you're acting as though you're okay, right? So if you're in a situation where you typically panic, and you found that out because you've done a an analysis of that, a pattern analysis, you say, "Don't you know? Most often I panic when I'm in this particular situation." Well, if you're in that situation and you panic, by staying in it, you're training yourself to see that it's okay. Okay, rather than training yourself to believe that the thing to do is to leave. Okay. The eighth technique is called anti reassurance statement. Giving yourself an anti reassurance statement. And it's simply telling yourself, I don't need certainty to continue. I don't need certainty to continue. Sometimes what people do is they insist on a guarantee. I must have a guarantee that if I drive across this bridge, it will not collapse. I must have a guarantee that if I get on this airplane, that it will not crash. But the fact is, you don't need a guarantee to drive across a bridge. You don't need a guarantee to get on an airplane. Um, you don't need certainty to do these things. To get on an airplane, you need to get on it. That's all you need. But what reassurance seeking does is it strengthens that panic long term. Okay, so by refusing to seek reassurance, by refusing to reassure yourself, you're training yourself to believe that you don't need it. Okay. Let's see here. All right, great. And then the ninth technique is called behavioral reversal. Behavioral reversal. And so, what you do with that is, so let's say that you're engaged in some activity. Let's say you're cooking. You're cooking for your family, and you start to panic. So, what you do with behavioral reversal is you continue doing that activity. In this case, you continue cooking at normal speed. Okay, at the normal speed, at the same speed that you were. You just continue doing it as if you're not panicking. Okay. So if you're walking and you start to panic, you just keep on walking. If you're talking when you start to panic, you just keep on talking. If you're driving when you start to panic, you just keep on driving, as long as you can continue to drive safely, which you probably can. And so, what you're doing when you just keep on doing the activity, continue the activity, is at the normal speed, is that you're once again acting as if it's okay. You're acting as if you're not in danger. When a person panics, they're acting as if they are in danger, but when you just continue doing what you're doing, you're acting as if you're not in danger and training your brain and yourself to realize that it's okay. I'm all right. I don't have to stop what I'm doing just because I'm panicking. Okay. All right. So the fastest way out of panic is to stop trying to get out of it, is to stop fighting it. So these are brief methods to deal with panic at the time if you are panicking. But if you want to stop panicking altogether, you probably need to do more work to correct the cause of it. And when people panic, they're equating something with a life or death situation. So therefore, if you notice with your pattern analysis that indeed you usually panic when you think about certain things or when you're reminded of certain things or when you're in certain situations, you then need to break that down to ask yourself, well, what am I afraid of in this situation? What am I equating with a life or death situation? And then examine that fear. Am I indeed in danger the way I've been acting as if I am? And work to because if you are, that's one thing, right? But it's doubtful that you are in that kind of danger, and so if you're not, it's time to start practice, or it's time to develop that thought. When I'm in this situation, when I'm around people, I am safe, and here's why I am safe. You know, Perhaps it's a social phobia type of fear. I'm afraid of how people will evaluate me. I'm afraid of what they will think of me. So you work at correcting that. I need not be concerned with what they think of me. God only knows what they think of me. Who cares? There's no way for me to know it anyway. What matters, what might matter, is how they treat me. So if they're treating me in a way that I dislike, I might work to address that with them. But otherwise, as long as they're not mistreating me in any way, what they think about me is irrelevant. You see, so that's the kind of thing that if a person's panicking over, for example, social phobia type concern, then ultimately the way to stop it altogether is to correct that fear. Okay, and we'll be talking much more about these things over the weeks. And so the Rational Living Show is broadcast every Wednesday at 7 p.m. Eastern United States time on YouTube and LinkedIn and X and Facebook, and also and you can listen to the recordings and watch the recordings on those formats, as well as listen to the podcast wherever you listen to podcasts. And I encourage you to share the show and the fact that we're on with your friends and your relatives and people who you think could benefit from learning these things. Thank you so much for watching, and I look forward to seeing you the next time.